Vintage Fitness, talking to you again about shoulder pain, a common complaint, a common injury for athletes and general public alike. So I'm going to show you just a couple of things, simple things you can do at home on your own. These will be good for impingement syndromes, tendinitis in your shoulder, rotator cuff strains, frozen shoulder. The idea is to strengthen and mobilize that shoulder, break up some adhesions, get some better blood flow into that shoulder. The reason shoulder problems happen so much is it's really sort of an imbalance between the front and the back part of the shoulder. Life in general tends to pull us forward. So for instance, writing on a desk, typing at your computer, texting on your cell phone, driving. What tends to happen is the shoulders get pulled forward. So the front part of the shoulder gets over contracted, things shift forward and sort of pinch and impinge in there, and then the back part, especially that rotator cuff, gets pulled and stretched too far and becomes weakened over time. So what we have to do is try to correct some of the imbalance there, open up the front part and tighten up and strengthen the back part, along with just getting better blood flow pumping into the shoulder, which will help to eliminate toxins, inflammatory buildup, maybe even help to break up some adhesions as you mobilize that joint. So we're going to use a simple tool, just a little piece of TheraBanding here. My suggestion is you can go out and get this pretty inexpensive. Start with maybe a light band first, and then maybe even having a medium size for later as you get stronger. You probably won't need much more than light to medium. The heavy stuff with these muscles that we're working, they're not big, powerful muscles. They work all day and they're important, but they're not big and powerful, so you don't need to push the resistance so much. You want to work repetitions and just sort of work at a nice pace so that you're getting a lot of endurance and a lot of blood flow into the shoulder. So little TheraBanding is what we're going to use. First exercise I'm going to show you is something called a pull apart. And we're going to hold the band in our hands. Thumbs are sort of pointing at each other. And you want to start with just a little bit of tension on the band. Try not to start with it here. Okay, you're going to lose a lot of the work if you start there. So start with just a little light tension on the band, and then all you're going to do is, and what I suggest is stand at good attention, squeeze your butt cheeks tight, your quads tight, and look up a little bit. Try not to look down. Look up, because the idea is you want to open up your chest and squeeze the shoulder blades on the back side. So what we're going to do is take our band, a little bit of tension, and then all we're going to do, it's a 2-second count back, a hold for 1 second, and a 2-second count return. So we're going to go 1001, 1002, 1001, 1001, 1002. What you want to try to prevent is don't go too quick and don't allow the band to snap you back. That goes for all of these exercises. That's a concept you've got to maintain. You don't want to let the band snap you. Keep this under control at all times. So here we go. Pull aparts. Thumbs point at each other. We hold the band and begin. 1001, 1002. Open up the chest, squeeze the shoulder blades. Now 1001, hold and back. 1001, 1002. That's one rep. Here we go. 1001, 1002, 1001, 1001, 1002. 2. 1001, 1002, 1001, 1001, 1002. 3. You're going to do a total of 12. And then you're going to repeat that for 3 full sets. 3 sets of 12. So you'll do your 12, take 15, 20 seconds, shake your arms out, roll your shoulders out a little bit. A little reverse shoulder roll is a good idea. And then right back into it. So not a big break between sets, maybe 15, 20, 30 seconds tops. Go right back to it. The idea is to really get some blood flow pumping into the muscles that you're working, okay? The next one we're going to do is horizontal external rotation. So you're going to hold your band again. This time, thumbs are going to point away from each other. Thumbs away, elbows tight to your sides. Again, you want to start with just a little bit of tension on the band. And now the idea, again, stand at attention, squeeze your butt and your quads tight, look up a little bit, and we're just going to rotate out as far as you can comfortably go. If you're nursing an injury, you may not go as far. Fine. Go to where you start to feel a little bit of grab in that shoulder. Don't go beyond it and come back. Work within that range of motion to start with. What you should see is over time, as you get stronger and healthier, that range of motion increases. And everybody's range of motion is different. So some people can really rotate them out, some people not so much. It just depends on your individual range of motion. So don't get too comparative with other people next to you. Just stick to what works for you. Stay within the pain-free range of motion. And then as you get stronger and better, hopefully that range of motion will increase a little bit. So here we go. Horizontal external rotations. Holding that, thumbs point away, elbows tuck in tight to your sides. Little bit of tension on that band to start with. Stand at attention, look up a little bit, and externally rotate. So all the way out, hold, slow back. Same kind of count. 1001, 1002, 1001, 1001, 1002, 1001, 1002, 1001, 1001, 1002. As you get better at this, you won't have to necessarily count all the time. You will kind of learn the pace, and you'll just do it naturally. Again, big key here, stand tall. The idea is to sort of open up and squeeze on the back side. So as you're doing this on the back side, standing tall, squeezing here, and here we go. 1001, 1002, 1001, 1001, 1002. 1001, 1002, 1001, 1001, 1002. There you go, okay? Horizontal external rotations. 12 reps, 3 sets. Again, give yourself 15 to 30 seconds break, then go right back at it, okay? So first is the pull-aparts, then the horizontal external rotations. I'm going to give you one more with this little tool. And this one is called the full glass or full can exercise. And what you're going to do is you're going to hold the band. I tie a little knot in it just to give me something to grip against. Okay? You're going to hold the band sort of at your side. You're going to point your thumb up. It's almost like holding a glass, right? That's where the name comes from. It's like holding an open glass, right? You're holding the glass, the top is here. Okay? So same kind of grip. And you only want to go up as high as parallel to the floor. If you're nursing, especially like rotator cuff stuff, supraspinatus in particular, if you've got some tendinitis in there or strain in there, you may find getting up to parallel is difficult. So don't worry about it. Again, work within your pain-free range of motion. Go to where you can, stay in that range in the beginning, and as you get better, you should see that you can elevate your arm higher and higher. Okay, so open glass technique is here. We're holding the band, and it's going to be on a bit of an angle. It's almost like sort of where your pocket is. So it's not straight out in front. It's not straight out to side. It's sort of in that in-between zone. So sort of in line with your front pocket. Okay, so we're holding the band, thumbs pointing up, standing again, good attention, right? Hold your core tight, your glutes tight, your quads tight, everything's tight in here, okay? Look up a little bit, it'll get you going in the right direction. If you're looking down, you're gonna lose out on some of this. So look up a little bit, and again, it's 1001, 1002, 1001, 1001, 1002. That's rep 1. 1001, 1002, 1001, 1001, 1002. Okay? Again, if you're struggling with a strain or an impingement syndrome of some sort, you may only get to here in the beginning. And then that's what you work. But it's the same count. It's 1001, 1002, 1001, 1001, 1002. As you get healthier and stronger, hopefully that can go higher. And then about parallel to the ground with your arm is as high as you want to go for this exercise. Okay? Now, the way we do this one is, we'll do 12 on the right, okay? Immediately switch over Even if this shoulder doesn't bother you, you're still going to work it. Work the other shoulder. Okay, same thing, right? 12 on that side. Then no rest. You go right back to the right side for your second set. Immediate to your left side for the second set. Back to the right for a third time, and then back to the left for the third time. So every time you're working one arm, the other arm's resting, so you don't need a big rest. So all 3 exercises, 3 sets, 12 reps each. Okay? That's the use of this little tool. The other thing we want to do is just maybe open up and stretch a few things in front here. So the pecs in particular get tight and roll that shoulder forward. The bicep tendon oftentimes gets caught in here because things are pinching too far. And then out here, a lot of times people get a lot of pain right out here because that supraspinatus tendon attaches in here. Actually, all the rotator cuff tendons pretty much attach right here. And because the shoulder rotates so far, it's kind of pulling and pinching on things in there. So we want to try to open this up. So an easy way to do this is using a wall. And a simple exercise is this. I like 2 in particular. In order to get the pec, I like the arm in this position. If you're having real shoulder pain, you may have trouble getting it up to that parallel position, so you may have to start with it down lower. That's okay, but I put it right up to the wall and then turn away from the wall and try to stretch that pec. Use your eyes to help you. Turn right away and look away. Okay? Give yourself a 30-second stretch. Then change over, do the same on the other side. I would do each one 3 times through, 30 seconds each. To get this bicep area, this oftentimes gets bound up and tight and adhesed. You want to take your hand and you want to put your thumb against the wall. So your thumb goes here and you are now turning and rotating away. And that will get more of your bicep tendon. Again, if your shoulder's sore, you may have to drop it down. You may not be able to get it up so high. That's okay. Again, you work within your pain-free zone, whatever that is. Okay? So these are a few simple things. This whole workout only takes maybe 10 minutes. You're done. Do it at least 3 times a week. I would shoot for every other day. Best if you don't do it necessarily every day, back to back to back. If you go every other day, then some weeks it's going to be obviously 3 days, some weeks it'll be 4. The other thing is, you've got to be consistent and you got to be patient. Most even simple shoulder problems are going to take you a good 3 to 6 months to recover from. Sorry, that's just the way, shoulders are complex, that's just the way it is. And I find that 90% of overcoming shoulder injuries is actually the rehabilitative exercise component. You can go and get all kinds of great treatment, but in the end, the most important part is rehabilitating that tissue. So you gotta, in short, you gotta do the work. Just do the work, okay? So 3 to 6 months, be patient, work it, don't overwork it, work within your pain-free range of motion, be consistent, stay at it, and check back here for future videos, and we'll try to help you out with other rehab needs. All right, so Joel Palmer, Vintage Fitness, stay strong. Remember, life is heavy, train for life. We'll see you next time.